Medications for opioid use disorders in correctional settings. Shifting the paradigm, creating a balanced correctional and rehabilitative approach. The Opioid Response Network is funded by SAMHSA to provide resources and technical assistance needed locally to address the opioid crisis. This video is part of a series to provide guidance on the implementation of medications for opioid use disorder in correctional facilities. Leading corrections and behavioral health experts present information on topics such as the use of medication, models of delivery, diversion, and linkages to care and community support. Patricia Coyne-Fague welcomes state officials and other dignitaries.
Thank you. Good morning. My name is Trish Coyne-Fague. I'm the director at the Rhode Island Department of Corrections, and I'm really glad to be here to help welcome you to this very important conference, and also welcome you to Rhode Island if you've never been to Rhode Island. I'm a lifelong Rhode Islander, and I also talk very fast. And I'm hanging on to the podium so I don't do a lot of this, which I do. I'm a lifelong Rhode Islander, and so while there's, I think, a lot of things that we can rightfully brag about in this state, one of the things is definitely our restaurants. So if you go out to eat in Providence, frankly, you can't go wrong. Rhode Island Department of Corrections is a unified system, and that means that our jail and our prisons are all under our jurisdiction at the Department of Corrections. There are no county jails in Rhode Island. Approximately 13,000 individuals go through our intake service center or jail every year. And our average daily population at the adult correctional institutions is about 2,700. We're also responsible for offenders on home confinement and the supervision of upwards of 24,000 offenders on probation and parole. Every day brings a new challenge, as the field of corrections has evolved to be about so much more than just custody. Simply making sure people don't escape isn't enough anymore. Besides our restaurants, another thing that Rhode Island can rightfully brag about is our medication-assisted treatment program, which is why we're all here at the Department of Corrections. And as director, I'm very proud of the work our staff does to help inmates with opioid addiction. Early on in her first term as governor, Gina Raimondo allocated $2 million in her very first budget request to establish the MAT program at the ACI, the Adult Correctional Institutions. And our General Assembly thankfully saw the wisdom in that and approved the money, and the program began. And through the dedication of the men and women who work at the Department of Corrections, from the top level to the rank and file, medical and security, some of whom you're going to hear from at this conference, lives have been changed and lives have been saved. And if you haven't heard this statistic yet, you will by the end of the conference, probably more than once, so let me say it first. In the first 6 months of the MAT program at the DOC, post-incarceration opioid overdose deaths in Rhode Island decreased by over 60%. As you will also learn, the program has not been without its challenges. It is a prison. Drug diversion, staff resistance, logistical problems, and resource issues keep us ever in motion, looking for ways to do it better, smarter, and more effectively. And conferences like this allow us to learn as well as share our experiences, so that all of us can go back and to our facilities and do better. Like most organizations, the Rhode Island Department of Corrections has a mission statement. Here it is. The mission of the Rhode Island Department of Corrections is to contribute to public safety by maintaining a balanced correctional system of institutional and community programs that provide a range of custodial options, supervision, and rehabilitative services in order to facilitate successful offender reentry into the community upon release. It's catchy, isn't it? Central to our mission, though, is obviously public safety, but core to public safety is the recognition that we have an obligation to discover what factors led to criminal behavior and then provide offenders with the tools to address them. It's not enough that when they're released, they don't commit new crimes. They need to be productive, healthy, contributing members of our communities. And they can't do that if they're dead, plain and simple. It's been said, and if you're not from Rhode Island, it's hard to get your head around this, but it's been said that in Rhode Island, there is no more than 1 degree of separation between any two people. It is absolutely true. If I don't know you, I know someone you know, and we might even be related. When you grow up in Rhode Island, you learn to be very careful about who you badmouth and who you badmouth to. What that also means is that every single person in Rhode Island knows someone impacted by opioid addiction. Everyone is touched by it. And so the work that's being done to prevent opioid overdose death impacts every single one of us. I was thinking the other night about when I was a kid, riding in the back of the family station wagon with my little brother. No seatbelts, no car seats. My brother was a toddler, he was a baby, and he had something called a car bed. Does anyone remember these things? Car beds? It's basically a box you would put the baby in the back seat. Not attached to the car in any way, totally safe. We'd be driving along while my mother chain smoked non-filtered cigarettes with the windows up. When I was about 7, my mother would give me 75 cents, I'm really dating myself, 75 cents to walk to the corner store alone to buy her a package of cigarettes. Nowadays, my mother would probably be arrested, and I'd be in state custody. But back then, all of this was normal. It's just what people did. No one even questions now that you have to have car seats, that you shouldn't smoke in front of your kids, or at least roll the windows up. And can you imagine sending a 7-year-old to go buy cigarettes? My point is that I really believe that while right now it can be a struggle to explain why it's a good idea to start an inmate who's been locked up for 10 years on medication-assisted treatment in anticipation of his release, it's simple. It's what we should do, and I believe that this will become accepted as very simple, and I look forward to the day that this is accepted and leaving people to overdose upon release is viewed as just crazy. And I've charged our staff to never forget that regardless of the crimes people have committed in our custody, everyone in our custody is somebody's son or daughter, brother or sister, father, mother, loved one, friend. I'm proud of the work we're doing to keep people alive. I'm thrilled that our state is such a force in this initiative, and I'm grateful for the work that all of you are doing that I'm sure will one day lead to the end of this crisis. Welcome to Rhode Island, and enjoy the conference. Thank you.
Technical assistance is available to support the evidence-based prevention, treatment, and recovery of opioid use disorder. To request technical assistance, visit opioidresponsenetwork.org.